Up to 1 million babies die globally on the first day of their life. This is according to a new report by Save the Children. The report shows that half of first-day deaths around the world could be prevented if the mother and baby had access to free healthcare and a skilled midwife. The research also found that an additional 1.2 million babies are still born each year. The report urges governments to enhance training and equipping of health workers to safeguard the lives of newborn babies. Now let's discuss this issue further. We're joined here in studio by Ms. Janti Soeripto. She's the Deputy Chief Executive Officer at Save the Children. Thank you for joining us. Okay. So what are the contributing factors to the statistics we're seeing of newborns dying, especially in sub-Saharan Africa?
There's a number of reasons why children die on their first day of birth. And there are basically three key factors. One is around preterm births, so low-weight births, and that's largely because of poor antenatal care, women and girls giving birth at a very young age. There's infections. When babies are born, they're very susceptible to infections, so low rates of immunization and low skilled health care to catch that is a reason for that. And then there's complications during labor, which can lead to stillbirths and maternal deaths if there is no skilled healthcare worker available to actually do an intervention if necessary.
South Sudan has been one of the casualties, especially with very high numbers of newly born babies dying in maternal deaths.
Yes.
And a lot of people may wonder why we're having these huge numbers from South Sudan, given that its population is not really quite high. It's not as high, you could say, as some countries such as Nigeria, for instance.
Yes, so the percentages are bad. South Sudan is the worst country in the world when it comes to maternal deaths in particular. And there's a number of factors, not unique to South Sudan, but it comes to the fore in that country particularly. There's years of conflict have taken their toll. There is poor infrastructure, so poor access. It's a widely spread out country. So healthcare, it's very difficult to get healthcare workers to certain areas. People are spread out, pastoralist communities. For them, it's difficult to actually get access to the right clinics at the right time. There's only a 2% immunization rates of newborns in country, which is exceptionally low, making them more susceptible to preventable infections. So those factors combine, and the South Sudanese government, we think, is trying to work to make it better, but this will not happen overnight.
Yeah. Is there commitment from African governments, especially in terms of budgetary allocation, to try and deal with this sad situation?
It's become better. I mean, in 1994, African governments signed up in Abuja to spend 50% of their spend on health. Sadly, though, even today, only about 6 out of 54 countries have actually achieved that number. In this report of ours, we are calling upon African governments to actually, all governments in the world, to at least bring the number up to a minimum spend of $60 per capita per person, which is the WHO recommended threshold. And over 10 countries in Africa don't achieve that either. So there is an element of, there is still lots of work to do by African governments to really make that commitment.
Right.
And then there's also it's not just about the absolute rate of spend, but it's also how we spend it, right? And there's a huge inequity across countries, across the world, not just in Africa, where we see a huge difference between women giving birth, for instance, in urban communities versus rural communities, or in terms of income. There's a huge gap in terms of income inequality. So even if the spend goes up, it doesn't mean that it's necessarily spent in the right way.
And what measures have Save the Children put in place to try and reverse this situation?
We're working on all levels. Clearly, we're trying to advocate with governments, with reports like this, to basically say this is the situation, these are the factors, we know what needs to be done, and there's actually quite a number of very cheap interventions to make the situation better. We're also working on the ground to actually to get that evidence that simple measures like kangaroo mother care for preterm babies, like chlorhexidine to sterilize the umbilical cord after birth, cheap, simple, available solutions that can help make the situation better. So we are working with hospitals in South Sudan to deliver 30 babies a day and do that in a safe environment. So we train healthcare workers in communities to provide that life-saving service to mothers in very remote places. So we're doing a number of interventions both on the ground as well as taking that evidence and then talking to governments and state and federal ministries of health to help them also to see how they could improve things in their particular situation.
All right. Janti, thank you very much for joining us. Janti Soeripto from Save the Children.